Everyone at some point in their life has had an experience in a hospital. And almost every time you are in the care of a healthcare professional, there is a wait time. Most of the time, we jump to conclusions, saying the nurse is just taking her sweet time. Have you ever stopped to think that they have more work than they can handle? There is a shortage in all healthcare professions throughout the United States. One shortage in particular that we should be very concerned about is the shortage in registered nurses. The current estimate is a deficit of nearly 1 million nurses by the year 2022. Nursing shortages are nothing new for our country. However, we have never seen one like this. Our nursing shortage is caused by an aging workforce, aging population, and shortage in the education field. Registered nurses represent the largest healthcare profession in our country. A registered nurse is an important healthcare professional that has earned an associate's degree or bachelor's degree and has some of the biggest responsibility in providing direct patient care. Although registered nurses represent the largest healthcare profession, the number of nurses coming into the field is far less than the number retiring from the field. The nursing shortage is greatly affected by the aging population, the aging workforce, and the waitlist in the nursing program. This shortage may be moving more towards a crisis. As our population ages, so does the need for new nurses. At least 80% of our elderly population have at least one chronic illness such as diabetes, arthritis, asthma, depression, hypertension, Alzheimer's, or lung disease. 68% of the population has at least two of these chronic illnesses. Yet, with medical advancements, these people are living longer than their parents did. Many nurses that currently care for these people decide to stay in the nursing profession longer because of the recent recession. Approximately 1 million nurses are over the age of 50. That means about 1/3 of our 2.7 million nurses in the field will reach retirement age within the next 10 to 15 years. With that many nurses exiting the field, why are people not going into nursing school? There is a strong link between a bachelor's degree in nursing and a patient outcomes. Because of this, many hospitals will only hire nurses with their bachelor's or nurses who are agreeing to go back to school if the company pays for it. Even though the market demand for more educated nurses, nursing schools are turning away thousands of qualified applicants, 68,000 of them in 2014 alone. Because there is a shortage of nurses, there is also a shortage of nursing educators. How is all of this affecting the healthcare field? Due to this shortage, many of our nurses are overwhelmed. Because of the shortage, many nurses are overworked, working long hours under stressful conditions. Most hospitals and nursing facilities are understaffed, making greater workloads for the nurses that are there. Working longer hours under more stress can result in personal injury and fatigue, an unfortunate outcome that patient quality care can suffer from, resulting in a variety of preventable complications, including medication error, emergency room overcrowding, and the more alarming is death. In review, the three main reasons for our nursing shortage are simple: an aging population, aging workforce, and the shortage in the education field. These three things are going to cause a lot of problems for our society, such as hospital-related deaths. Do you think that the nursing shortage could affect you personally, even if you aren't in the healthcare field? Are you going to think about the next time that you are stuck waiting for 30 minutes for the doctor?